Right, our final session, and it's time now to introduce the next Chief Executive of NHS Providers, Julian Hartley. His appointment, confirmed just last week, marks a big moment for the organisation as it works to represent all of you in the face of all the kinds of challenges that we've been discussing over the last couple of days. Many of you will know Julian from his achievements as Chief Executive of Leeds Teaching Hospitals NHS Trust, where he's been for the last 9 years, improving and strengthening the trust, developing joint working in West Yorkshire and playing a part at national level. His reputation as a champion of the NHS precedes him, and I'm sure you'll want to give him a warm welcome as he prepares to take on this vital new role at NHS Providers in February. Please welcome Julian to the stage.
Samira, thank you for that kind introduction. Colleagues, I am genuinely honoured and delighted to have the opportunity to serve you as your new Chief Executive, to champion and advocate for you all and indeed for our precious NHS at this most crucial time for the National Health Service. I want to pay tribute to the wonderful work of Saffron Cordery and NHS Providers team, who I know as a member have represented us and advocated for us so brilliantly over the last several months. And I'm really excited and privileged to be joining Saffron and the team early next year. Saffron and I are resolved to continue to serve you with the positive voice, influence and support that you have come to expect, and to use the combination of our complementary skills and experience to further champion the NHS at this most challenging moment. Our conference theme of resilience has never been more relevant or significant, and over the last 2 days, we've shared some fantastic examples of resilience in the face of, to quote Jeremy Hunt, eye-watering challenges. And just to reflect on the last couple of days, we started and we heard on the first day from Saffron, whose words resonated with me, we must make and remake the case for the NHS. And also, Saffron, the point you made earlier today about the importance of NHS Providers as an anti-racist organisation, and certainly one that I want to work with you to support, embed and take forward with our members. Secondly, I think our role as trusts in reducing health inequalities, we had a great panel session on this, and the really important question of providers working in systems. And I've seen myself the importance of provider collaboratives in West Yorkshire and working closely with Rob and Kathy in the ICB, but working in tandem to make sure that the provider collaboratives make a key contribution to delivering effective change and improvements in delivery and care. It was great to have the Shadow Secretary of State, Wes Streeting, and I think it signalled, didn't it, the importance of engaging with and influencing about the NHS across the political spectrum. Good to see Chris back on the session on innovation and the importance of innovation in the context of the challenges that we're facing. And I think those of us that were at the dinner last night could not have been failed to have been inspired, moved by the wonderful example of resilience from Arma Latif. And if you weren't at the dinner, do check out his website, Travel Eyes, incredibly inspiring. We heard from the Secretary of State, and it was good to see and hear that the focus on workforce. But I do think there was a really important challenge from our colleague from the Black Country Partnership on mental health. And also, Jag, your challenge on health inequalities. And important to continue both of those themes in the context of our work. And then a great panel on inclusive leadership. And I was really struck listening to Peter Redding describe the importance of our disabled leaders. And it really resonated with me, Peter, when you talked about the importance of our colleagues with learning disabilities and autism. And certainly one of the most inspiring things that I've done in the last month or so was welcome our apprentices in Leeds teaching hospitals who've been on a programme with us and Leeds Lighthouse and their colleagues with learning disabilities and autism that have joined us and are now converted into full-time roles. And the impact of that, not just for them, but for the whole organisation, has been profound. And then Amanda's session, again, I think resonating with me. We are the NHS and putting patients first is what we do. Exemplified by Oliver's story from Cambridge. And Navina, I did want to say to you directly, Navina and I worked together developing the Interim People Plan in 2019, and the importance of the point you made about engagement and morale connected to performance, productivity, and that is so vital in terms of the pressures and the constraints and challenges we face. And I can't think of a better person we need right now to be leading us on the journey to plan the workforce of the future. I want to thank the whole NHS Providers team for a fabulous job organising a brilliant conference, the first in-person event for 3 years. Isn't it great to be together again? And the last couple of years have challenged us all well beyond what we've experienced ever before. Tackling the biggest public health crisis in the history of the NHS has required resilience of a special kind. For many of us, it's tested our teams and frontline staff to the absolute limit. Yet I also believe it's cemented that unbreakable bond between trust leaders and frontline staff. And that, I think, in all our organisations is crucial. We can't underestimate that as we head into probably the most difficult winter we've ever faced. And I know how much we all do as leaders and will continue to do to support our frontline staff, in particular, our brilliant nurses and midwives, the best in the world at this turbulent time. Our deep and collective resilience will be required and tested again and again as we continue to tackle the multiple shockwaves from COVID, together with those pre-existing and fundamental challenges of workforce supply and social care. And we now add to this the current economic crisis and today's news that the headline rate of inflation is now above 11%. And the impact of that on our teams and our organisations. And we collectively, I'm sure, nervously anticipate tomorrow's autumn statement. We did have some hints from the Secretary of State, but we'll know more tomorrow. So if those are the challenges, and they are enormous, aren't they, in size and scale, then we need the deepest reserves of resilience and the very best leadership to respond to them. But as I look out at all of you, I see the leadership which will get us through this period, and the leadership which will strain every sinew to serve our patients, support our staff, and deliver for the public, to ensure the NHS weathers the storm, just as we did during the height of a global pandemic, to the sound of applause on every doorstep. For me, this means a move from a trust leader to a supporter, champion, advocate of all of you, as together we face these challenges. My early priorities will be engagement with you in your patches and your localities, particularly mental health, community and ambulance services. Working with Saffron to continue to support the brilliant NHS Providers team to support you. Further developing our offer on improvement, both for trusts and provider collaboratives. Continuing to support our emerging leaders, particularly our ethnic minority leaders, still significantly underrepresented in senior NHS roles. And of course, influencing positively and constructively with NHS England and government on your behalf. Because as trust leaders, we've not just difficulties and challenges to highlight, but also ideas and solutions which need backing and support. The NHS is an engine for innovation and economic growth, and worthy of investment. And we must champion that cause at this time of economic distress. So I look forward to working with all of you at this key moment and feel privileged to serve you as your new Chief Executive. I wanted to thank Samira, you, for a fantastic hosting and presentation. It's been a great conference and I've really enjoyed being a part of it. I wanted to thank Ron and Saffron and the whole NHS Providers team, who I've had the pleasure of getting to know over the last couple of days, of starting that process of getting to know the team. What a fantastic team it is. And thank you to all of you for finding the time to come together to reflect, share, and hopefully recharge and build some of that resilience we all need as we start to work through the big challenges that we face. So go well through winter, and I look forward to seeing you all next year. Thanks very much, everyone.